Why is Congress afraid to consider single payer, and how do we best combat the influence of the health insurance industry?
Healthcare industry contributes millions of dollars to people running for office. Do I need to explain anything else?
Let's hear from Vicki Ryder. She's got a short case study she wants to talk about.
I was going to tell you about my son who was in a serious accident while he was traveling abroad. Would spend 10 days in intensive care, another 3 weeks in hospital without a single penny of cost because he was out of the country. When he came back, his doctor informed us that he would need a hospital bed so that he could pull himself up. And even though we were fully insured, our insurance company refused to pay for the hospital bed, telling us that it was not medically indicated when they had never seen my son, never seen his x-rays, never spoken with his doctor. But I want to tell you about somebody, Chairman Conyers, that you met in Detroit, a raging granny in Detroit who saw you when you were there recently. She has a daughter who graduated from college, got a job. The day before, she had been on the job for a year. She was dismissed without cause. As a result, she was not only out of work but uninsured with a very bad case of asthma that could not be controlled. She could not afford the inhalers, could not go to a doctor. 3 weeks ago, Dawn had an episode. By the time she reached the hospital, she was dead. How many more Dawns do we have to bury before we see some changes in this system?
Studies show that once people have insurance, utilization increases. If the currently uninsured 47 million people gain coverage via a single-payer system or some other means, what plans are in place to develop a healthcare infrastructure, for example, hospitals, providers, treatment centers, rehab facilities, that can adequately absorb all of these new patients?
We've got to provide for more nurses, for more family doctors, for more pediatricians, for more clinics, for more hospitals. And that comes in other surrounding legislation.
Of course, there'll be increased capacity in other countries when single-payer systems have come into play. There has been a burst of demand, but then it's leveled out over years as people have long reserved needs taken care of and then situations stabilize and reach equilibrium. But in addition to that, don't think of it as a constant demand for high-end tertiary care facilities or the like. A lot of our medical care system is now used in the most expensive and inefficient way possible because people without insurance coverage wait to the very last minute until they're bleeding out or worse and come in a very emergent circumstance which requires the most high-level, most expensive kind of care. If there were a universal single-payer system, people would have primary care physicians and they would move up the system as their needs are addressed.
When people talk to me about the fact that somehow the current system is working, and they throw that up as a symbol of why we don't need change, and they say, well, you know, everybody has access to some level of health care. I look at them and I say, well, there is a measure of truth in that. Because in fact, over now, 50 million Americans seek their health care at the emergency room, which harkens back to what Ted just said about the most expensive and most inefficient way of providing health care humanly possible.
The horror stories in Canada. We hear about the long lines, you can't get needed surgery, it's a complete mess in Canada. One thing, I did some research this morning and I found that in the United States, per person, we spend $6,700 a year on health care, and in Canada, they only spend $3,700 in Canada. And the obvious conclusion from that is if we went to a single-payer system and we weren't wasting 30% on every dollar to sales commissions, advertising, profits, executive salaries, assumedly, if we spent this amount of money, we would have the Cadillac of all healthcare systems. It would be much better than Canada. It would be as rational as Canada, but much better. Any comments on the myths about Canada?
The essential item is that if Canada had the per capita expenditure on healthcare the United States does, there would be no queuing, there would be no problems. They spend about 2/3 at most as much as the United States, get far more in terms of outcome measures, infant mortality data and the like than the United States. And the queuing problem is a question of resources, which is in turn politically controlled. But just some data. One of the things that people say when they use these cross-border comparisons and scare tactics is though Canadians are fleeing to American hospitals. And Canadians are going for care in American high-end institutions. This is a study published in Health Affairs, the most prestigious health policy journal in the United States. It reported the year before the study was done, a few years ago, 40% of U.S. ambulatory facilities near the border treated no Canadians in that year, and another 40% treated less than one. That's the fact, not the lie.
I'm a registered nurse, and I work in a public hospital in Syracuse. And my job is discharge planning as part of the continuum of care. Once people are ready to leave the hospital, to assure that they'll be able to get the medications and the services that they need. What I'm seeing in my work at a public hospital is worse than any kind of long lines because of insurance companies consistently denying services and having co-pays above and beyond what people can actually afford. And we discharge so many people who can't afford the medicine that doctors are prescribing. I have to ask doctors constantly, can you prescribe something cheaper? Is there something equivalent? Is there a generic? Very often there isn't.
2000, my husband, at 32 years old, never having had a cold, was diagnosed with stage 4 non-Hodgkin's lymphoma. We thought we had Cadillac health insurance. We were hardworking Americans. We went to school. We made good choices. I'm the child of a preacher. Okay, we thought we did okay. In order to save our home, I had to stand in bankruptcy court and ask for some help. But why is it that when you work hard, you go to school, you do all the things that the good American book tells you to do, that you cannot be covered? My husband and I have worked since we were 14 years old. Before that, I had paper routes, I did laundry, I babysat. When I got my first green little working papers card, I worked every summer after school. I paid taxes. Why is it that my country cannot take care of me? And that's it.
To ensure that your story does not repeat itself again, we must rise today resolute in the proposition that health care is not something we have to die for. It's something we must live for.